Welcome everyone, and thank you for joining today's info session on mental health and addiction support worker certificate at Ashton College. I'm Pamela from the marketing team, and I'll be your host. I'm thrilled to introduce Nadia Tajdin, one of our instructors. Nadia has a deep passion for mental health, being an extensive experience in public health, dementia studies, and personal support work. She's worked with youth, families, and communities to support mental health, addictions, and trauma-informed care. Today, Nadia will share insights about the program, career opportunities, and her personal experience. You can submit your questions anytime via the chat or Q&A, and we'll get as many as we can at the end. Okay, let's dive in. Hi, Nadia. Thank you for being here today.
Hi, thank you for having me.
It's great to have you here. Let's kick in. How would you describe the role of a mental health and addiction support worker in today's healthcare and community setting?
Well, mental health and addiction support workers play a vital role in today's healthcare and community settings by supporting individuals as they navigate challenges with mental health and substance use. They offer compassionate and non-judgmental support while helping clients access resources such as housing and healthcare and social services. Their work goes beyond just immediate care. They promote recovery and harm reduction and teach coping and life skills and empower individuals to feel and make them feel safer and create healthier choices and communities. Support workers collaborate closely with the multidisciplinary teams, respond to crisis, and create opportunities for clients to reconnect with their communities through work, education, and meaningful activities. The role is also about advocacy. It's also about hope. So ensuring that each person feels heard, feels supported, and capable of building a better quality of life with whatever that looks like for them.
That sounds honestly great. And honestly, it sounds like you say it with such a passion that it's inspiring.
It's such a wonderful work to be able to be a part of these students' lives and see where they go from here.
And it shows, which is a great thing. What can students expect to learn in this program that prepares them for real-world work in mental health and addictions?
So students can expect to gain both the knowledge and the practical skills needed to step confidently into that real world work in both mental health and addictions. Students will learn how to support individuals with compassion, apply harm reduction strategies, and understand the complexities of concurrent disorders. Through case studies and simulations and collaborative projects, students will practice responding to a crisis, building intervention plans, and working within multidisciplinary teams. The program also emphasizes communication, advocacy, and cultural competence, skills that are necessary and essential when supporting diverse clients and communities. By the end, students are not only prepared to navigate the challenges of frontline work, but also equipped to make a meaningful impact in the lives of the clients that they'll be working with.
And what strategies are taught in this program for harm reduction and promoting mental wellness in communities?
Well, we dive into practical strategies that are happening in the real world right now. Students will learn about supervised consumption services, needle exchange programs, naloxone, and overdose prevention, but also about everyday harm reduction, like teaching safer substance use practices or creating judgment-free spaces. For promoting mental wellness, we highlight community-based activities, group programs, and public health campaigns. It's about helping people make those choices that improve safety and dignity and quality of life.
Sounds like a very important task to do, I guess. Which aspects of the program have you found that students find more engaging or beneficial?
I think they really enjoy the case studies, the simulations. We've had some students really enjoy having that real life experience. So having us talk about what has happened within their past and kind of reflect on that and kind of figure out what works best in certain situations. We find that a lot of students also enjoy discussing what's happening not only in Canada, but outside of Canada as well. I like to do these little research breaks within my classes where we talk about a certain topic and then we research, we figure out what we're interested, what we're passionate about, whether it's early childhood education or dementia care or it's substance use, and trying to learn what's happening in other places and that's not locally to them and bringing that back into those best practices that we want to incorporate in our own experience. So that is what I feel that students enjoy doing throughout the course.
Ooh, research break. That sounds so fun. Can you explain how the practicum works and why in-person experience is so important?
Yeah, the practicum is one of the most valuable parts of the program and an experience many students look forward to the most. It gives students the opportunity to step outside the classroom into agencies and clinics or community programs where they can apply what they've learned in a supportive environment. This hands-on experience allows students to build that confidence and develop professional relationships and see firsthand the impact of their skills in supporting clients. In-person practice is essential because it really bridges the theory that we speak about in class to real life, that reality. Students not only strengthen their technical skills, but also learn the importance of empathy and adaptability and communication in a dynamic way, often unpredictable situations. It's a chance to truly experience the work of a mental health and addiction support worker and prepare for the responsibilities of the role.
In your opinion, how does CACCF accreditation benefits graduates in terms of certification and career opportunities?
Yeah, so the Mental Health and Addiction Support Worker Certificate is accredited by the Canadian Addiction Counselor Certification Federation, or CACCF. So CACCF accreditation gives graduates a significant advantage as they enter the field. It ensures the program meets national standards of excellence, which not only validates the quality of their training, but also makes them more competitive in the job market. This recognition opens the doors to a wider range of employment opportunities in agencies and treatment centers and community programs, and demonstrates to employers that graduates are well prepared, ethically grounded, and committed to the ongoing professional development. And in short, CACCF accreditation really strengthens both the credibility and career mobility in this field.
Cool. And now that you mentioned graduates, Nadia, what type of workplaces or roles do graduates typically enter after completing the program, in your opinion, or what have you seen?
Yeah, so this is actually one of the best parts of this program is the variety of places graduates end up. And I have students always emailing me and messaging me, telling me what job opportunities they're going into now. It's pretty exciting actually to see where our graduates are going. Some go into hospitals or outpatient clinics, while others find their place in addiction treatment centers or community mental health agencies. A lot of grads find their passion working in shelters or outreach programs, or even supporting students through school services. Basically, anywhere people need support with their mental health or substance use, our grads are out there making a real difference.
That is very sweet, the connection you get to create.
Hmm.
Um, Which personal qualities of or professional skills are most important for success in this field, in your opinion?
So I think there's multiple here. So I think it's empathy and compassion to listen and genuinely care about people's stories. It's also patience and adaptability, since no two situations are ever the same and things can change so quickly. Strong communication and teamwork skills help us work alongside clients and families and other professionals, while resilience and self-care are also essential for managing the emotional demands of the role as well. Above all, it's about being open-minded. About being respectful and committed to walking with people as they take steps towards healing and recovery.
I guess empathy is always a good thing to carry around wherever you go, and most in these type of industries.
Yeah, and we'll talk a lot about emotional intelligence in class as well. Emotional intelligence is not a fixed trait. It's something that we can really learn as we go along, and it's something that I try to incorporate as we go through our lectures every week.
Oh, that's great. Very important. I would like to learn more about that personally. How does the program prepare students to work as part of a multidisciplinary team?
I love this question because I always tell my students that we don't work in silos, we work together. So this program places a strong emphasis on teamwork because supporting people with mental health and addiction challenges always involves working alongside other professionals. Through group projects and role plays and simulations, students learn how to communicate clearly, share information appropriately, and respect the different roles within a team. They practice collaborating with peers the same way they would nurses and social workers and doctors and community support staff in real life. The program also encourages students to see the value of diverse perspectives, understanding that every discipline brings unique expertise, and together they can create a more complete picture of care, whatever that looks like. By the time students finish, they're not only confident in their own role, but also skilled at contributing to the bigger team effort that truly makes a difference for clients.
That's so good to know. How does the curriculum addresses current disorders, harm reductions, and public health approaches?
Mhm. So the curriculum really weaves these themes throughout the program so that students see how they connect to real world practice and policy. Let's start with concurrent disorders. So when it comes to concurrent disorders, students learn how mental health and substance use often overlap, and they build the skills to recognize and respond to the complexities with empathy and with practical strategies. Harm reduction. Harm reduction is a core approach that we emphasize, showing students how to support people in making safe choices for them, whether that's through overdose prevention or safer use practices, or simply meeting clients where they are at. And from a public health perspective, the program helps students look beyond the individual to the bigger picture. So, addressing social determinants of health like poverty and housing and stigma, and exploring how policy and prevention strategies can make a difference at a community level, a national level, as well as an international level. But integrating these three lenses, students graduate with a well-rounded understanding of each of these through personal and systematic factors that shape mental health and addiction, and how to respond in ways that are compassionate and effective and grounded in best practices and in research.
Ooh. What advice would you give someone considering a career as mental health and addiction support worker?
Oh, I love this question. So, if you are considering a career as a mental health and addiction support worker, my biggest advice is to lead with empathy and lead with curiosity. The field is incredibly rewarding, but it can also be challenging. So it's important to stay open-minded, compassionate, listen, build trust, and support alongside someone on their journey. Be ready to work as a team, to continuously learn and relearn, and to practice self care so you can show up fully for others. If you're passionate about making a difference in people's lives and in your community, this career offers endless opportunities to do meaningful, impactful work every single day.
Beautiful, beautifully said. Nadia, well, this is our last question. I don't know if you have anything else to add. I think we covered a lot of great, important points. Like I told you, your energy is so, I don't know, I feel inspired too by you.
So glad.
But yeah, do you have anything else to add?
I guess I wanted to talk about a little bit about how the course is kind of set up. So right now I'm teaching a course that has synchronous and asynchronous students. So synchronous, meaning that we have live classes that you can log in at any time, and I'll be your instructor, whoever your instructor is, and you'll have classmates there as well. And we'll take part in real-time discussions, and you'll feel like you're in class with us together, just online. And then we have asynchronous learning, which gives you more flexibility, and you can work through pre-recorded lectures and posted activities and discussion boards on your own schedule. So both options are interactive and engaging, just in different ways. And I've had students in both kind of sections, and they've had great experiences in whatever works for their learning journey.
Okay, that's really great. Yeah, we're about to go to our audience just to see if they have an extra question. Well, one question that we have is, can students access recordings or supplementary material if they need to review the content? I know you mentioned a little bit about the two ways of learning here, and the flexibility about it, which is really good. But yeah, just to continue building up on that, do you have anything else?
Yes, so absolutely. All live classes are recorded and supplementary material be posted online. Students love this feature because it means that they can revisit complex topics and catch up if life gets busy, or simply reinforce your learning before a quiz, or let's look back at something before an assignment is due. So all the materials will be accessed online. Even if you miss a live day, that's totally fine. The recordings will be posted.
And that's really good because like it gives you the flexibility to learn at any time. And
Mhm.
also, yeah, if you're juggling with like a side job or anything, you can complete your program and at the same time do other things,
Exactly,
which is
exactly. The
really good.
program is really designed with flexibility
Yes.
in mind, knowing that many students are balancing work and family or other commitments alongside their studies. So with both this synchronous, so live online, and asynchronous, learn at your own time options, students can really choose the format that best fits with their lifestyle.
Thank you so much, Nadia, for sharing your expertise and experience. Hearing directly from an instructor is always inspiring. It gives a real sense of the program and what it is like to work in a mental health and addiction support. If you like to learn more or take more steps with a mental health and addiction support worker certificate, visit ashtoncollege.ca. If you have any more questions, please send an email to admissions. Nancy, yeah, our colleague there can answer any of the practicum questions or any specific questions that you may have. A link will appear very shortly on the screen where, there's more details on the program. And again, Nadia, thank you for being here today. We hope you find this session helpful. I look forward to seeing you in a future info session.
Thank you, everyone. Have a great day.
Thank you, Nadia. Have a good one. Bye.
Thank you. Bye.